Hey guys, it's Alex here from HEXA Health Hub, and today we are talking about shoulder pain, specifically shoulder pain that is linked with a decrease in your mid-back strength and endurance. Typically we see clients with this forward tilted and rounded shoulder posture developing that shoulder pain. So what we want to do is try and improve your mid-back strength and endurance to stop your shoulders from rounding and tilting forward and end up in this upright, chest up, shoulders open and back position. Now we do this by working on your rowing technique and then building strength in that position. So today we're going to show you the correct rowing technique and then some of the common mistakes that people typically make in the gym when trying to perform the perfect row. When we have clients present with postural related shoulder pain, they typically perform the rowing movement in the same fashion, whereby when the arms are forwards, the shoulder blade or the tip of the shoulder starts forwards, and then when they row backwards, that tip of the shoulder stays in that same position. So the pivot point of the shoulder stays in the same spot. So when we look at the row movement, it ends up looking like this. When the arms are forwards, the tip of the shoulder stays forwards, which is fine, and then as they pull back, the tip of the shoulder stays in the same position. So you're performing a row movement, but you're not actually getting any retraction or pulling back of the shoulder blades. That means you're not actually using your mid-back musculature very well. What I mean by that is you need to start thinking of your shoulder joint as being two joints. So the first shoulder joint is how the arm bone or your humerus interacts with your shoulder blade. So that's how we just demonstrated it then. When your arm is forwards, this pivot point of your shoulder is forwards, and then when your arm comes back, that pivot point stays in the same spot. The problem with that is when your arm's forwards, that's fine, but when your arm is now backwards, the shoulder ends up going into this forward tilted position, which ends up loading up into the front of the shoulder. Over time, that can start to cause a bit of shoulder pain. The second shoulder joint is how your shoulder blade interacts with your chest wall or your mid-back here. Using those muscles through there and using that shoulder joint ends up moving this shoulder joint from this forward position backwards, forwards, backwards. So instead of finishing in this forward tilted position of my shoulder, I can keep my arm in that exact same position and get this whole extra movement of my shoulder retracting backwards. Getting a row movement with that extra retraction or using that second shoulder joint of how your shoulder blade interacts with your chest wall, that is how you improve that postural strength through your mid-back, and that's how you're going to fix some of that postural shoulder pain. What that looks like with your row then is same as before. As your arms are forwards, the shoulder blades and that tip point of the shoulder can drop forwards, but as you pull back, you want to focus on retracting your shoulder blades as the arms pull backwards. Let them stretch and relax on the way down, and then as you pull back, the shoulder blades retract back and up together. Down and forwards, shoulder blades back and up. A lot of the time you'll hear people saying you need to pull your shoulders back and down, back and down. With this sort of movement, that's incorrect. You want to actually pull your shoulders back and slightly up. That's because the main muscles in between your shoulder blades that retract your shoulders, your rhomboids, they actually come from your spine and attach into your inside border of your shoulder blade, and they don't just go sideways, they go up on a diagonal angle. So if you're pulling back and down, you're actually fighting against the way that those fibers of that muscle wants to contract. So to get your mid-back working harder and using your rhomboids better, you need to be pulling your shoulder blades back and slightly up. So when you're in the gym and you test it, try and pull your shoulders back as far as you can while keeping them down, and then try and pull your shoulder blades back as far as you can and lift them up slightly. And what you'll find is that when you pull your shoulder blades slightly up, you'll get an increase in retraction movement or pulling backwards movement of your shoulder blades. And that's what we want to get really good at when we're working on mid-back postural strength with your rowing technique. So recapping that, you've got your two shoulder joints, arm connecting into your shoulder blade where you have this singular pivot point. Then you have your second shoulder blade joint, which is your shoulder blade attaching to your chest wall, which moves your pivot point forwards and backwards. We want to use both of those shoulder joints as you do your row technique. So the poor row technique is shoulders stay tilted forwards in that one position. Good rowing technique, engaging your mid-back postural muscles as your arms pull back, your shoulder blades retract back and upwards slightly to really engage through your rhomboids. there you have it, guys. That is how you improve your mid-back postural strength and endurance with a good rowing technique to help improve some of that postural type shoulder pain. If you have any questions or queries with that, flick me a message and I'll be happy to help you out. Thanks, guys.